Hello, everyone, and welcome. Thank you for joining us on a Thursday afternoon. My name is Jasmine Patel, and I am the Policy Director for the Partnership to Advance Cardiovascular Health, which we call PATCH for short. I also want to thank Amgen for sponsoring today's webinar. PATCH is a coalition of a number of doctor, nurse, and patient organizations that work for better healthcare for people living with heart disease. You can see on this slide the many organizations we collaborate with. PATCH's mission is about helping people. We want to make sure that anyone who has had a heart attack or stroke, or anyone who's at risk for having a heart attack or stroke, can get the care they need to live long, productive lives. We at PATCH are very lucky to be able to work with many amazing patients who have persevered through trying times. We also have the opportunity to meet and collaborate with healthcare leaders in cardiology. Usually our organization is fighting the good fight when it comes to making sure people living with heart disease have access to the medications prescribed to them by their clinicians. Today, however, we are having a heart-to-heart with you at home. So how do you navigate life once you've had a serious event like a heart attack or stroke? How do you manage your risk if you know you could have a heart attack or stroke? Is cardiovascular disease preventable? And what are the best practices for keeping your heart healthy? Tonight, we will have two conversations. Our first heart-to-heart will be with Dr. Tracy Macaulay. Dr. Macaulay is a pharmacist who practices at the University of Kentucky. Over the past 10 years with University of Kentucky Healthcare Pharmacy Services, she has held several leadership roles. She remains a clinical pharmacist for pharmacy services and cardiology. She has experience teaching pharmacy students, medical students, residents, and cardiovascular fellows in both didactic and clinical arenas, and is co-host of the CardioScripts podcast. Joining Dr. Macaulay in a later discussion is a very active patient advocate who we're so glad to have, who recently survived a heart attack. Everyone watching us live this evening should please feel free to ask questions in the Q&A box on your screen. We will do our very best to incorporate the questions in our discussions. So with that, I'd like to bring on Dr. Macaulay. Hello.
Hello, Jasmine.
Hi, thanks for taking the time to talk to us today about heart disease. And before we start, I want to first say Happy American Pharmacist Month. You are also the first pharmacist. Yes, you're also the first pharmacist we've had on this heart-to-heart series. So very heartfelt welcome to you.
Thank you for having me.
Generally, when we think about the most important members of a patient's healthcare team, our minds automatically recognize nurses, primary care doctors, and specialists. But pharmacists play an equally vital role because they are the final members of the healthcare team a patient speaks to before taking medications prescribed by their clinicians. And today, about 66% of adults take five or more prescribed medications per day, and 27% take 10 or more prescribed per day. So Dr. Macaulay, I want you to first talk to us about your role as a pharmacist. I know you do so many things in your setting, so give us the whole picture of exactly what you do.
Yeah, I think a lot of people know of and think of the pharmacist that they meet at their community pharmacy. And that is a very important role for pharmacists within our profession, but there are a ton of other roles. And mine is a little unique. I have additional training after pharmacy school, specifically in cardiology. And for the last 15 years, I've helped in partnership with our cardiologists and the nurses who provide care for cardiac patients, help treat patients while they're in their hospital with the cardiac conditions, and more recently in the outpatient setting. So pharmacists in this setting help make medication recommendations that are very specific to a patient, help engage patients in shared decision-making to help find medication regimens that are affordable, that are safe, and are effective in preventing and treating disease. And we do a lot of medication therapy management, monitoring drugs to make sure they stay safe and that patients have access and take them appropriately, really trying to help their overall cardiovascular outcomes when it comes to my specialty.
Thanks for that background. So, to get right into it, we organize this webinar as a source of information for people who have either had a heart attack or stroke or know that they're at risk for one. And so ultimately, when we talk about heart disease prevention, we are talking about preventing a heart attack in the first place. But there are different levels of prevention, primary, secondary, tertiary, for example. So can you tell us what these levels mean? And more importantly, what's the major difference between them?
Yeah, when we talk about primary prevention, we talk about recognition of risk factors and dietary and lifestyle patterns that lead to cardiovascular disease. Over 90% of cardiovascular illnesses are preventable. And so we really, really want to try to find patients in this primary prevention before they have disease to try to prevent that first heart attack or stroke event. We do that through missions like your organization, where we can reach patients when we identify that they have high blood cholesterol, or when they have high blood pressure, or if they have unhealthy risk behaviors like smoking. And we try to capture those things and help patients modify those risk factors as early as possible, because there are risk factors we can't modify, and those contribute to the other 10%. We can't control your family history. We cannot control things like the fact that we're all getting older. So we try to catch those things when we can. And secondary prevention is what unfortunately happens when we weren't successful in primary prevention. And now you've had an event, and we try to do things to modify your risk of having a second event. And that really is a teachable moment, a very highly motivational moment, where we can encourage patients to do all of the right healthy lifestyle choices, to take their medications as prescribed, and to do things like participate in cardiac rehabilitation to make their lifestyle get on the right track to prevent secondary events.
Thank you. And so, you talked about risk management, high blood pressure, cholesterol, et cetera. So how are we preventing those risk factors in the first place? What should I be doing, for example, to make sure that that progression doesn't happen in order to make myself at higher risk for a cardiovascular event?
Jasmine, a lot of it is about awareness. So it's knowing that this can happen and that this is the biggest health risk for all Americans. Even given all the COVID that we've had, we still see the highest rate of death is with cardiovascular illness. And so more than breast cancer, more than other things that women in particular identify as their risk, cardiovascular health is what's most likely to kill us. And so we encourage folks as young as 20 to know their numbers, to know what their cholesterol is, even as young as 10 if you have a high family history, especially if you have a family history of things like familial hypercholesterolemia. And if you do identify those risk factors, we talk about aggressively modifying them through lifestyle, of course, through dietary choices, but also when they can't be controlled with those things alone, also through appropriate medication management.
Okay. So speaking of medication management, we have a question that just came in. And the question is, I'm on a statin right now, but I have some side effects. Should I try a different statin or talk to my doctor about a different medication altogether?
So statins are the most common used medication in the US. I say atorvastatin, or Lipitor in particular, has been on the top of that list for over a decade. And so we know all the good, the bad, and the ugly. And you just mentioned one of the ugly, which is about 5% of our patients experience something called statin-associated muscle symptoms. Mm-hmm. And those statin-associated muscle symptoms can be very mild, or they can really be debilitating for some folks. They happen primarily in the large muscles of the legs, the thighs, and they can be a sign of a rare, more serious condition. But generally, they're just what we call myalgias or muscle pains. So yes, if they are intolerable for you or don't continue to get better with treatment, it is reasonable to try a different statin and maybe even a different dose. When I do this, I always say do it in conjunction with your cardiologist or your primary care doctor, as they know your individual risks. But it is reasonable to do something called a washout period, where you stop taking that particular drug just to test if the symptoms get better off of it. That also allows your muscles a chance to recover. And then we could try another statin at either a lower dose or in some cases, even a less frequent interval. And that can sometimes make the muscle pains go completely away. I generally try at least 2 to 3, sometimes in rare cases, even 4 statins before I give up, because these medicines are the backbone of our cholesterol management and have been shown to have major outcome benefits in primary and secondary prevention of cardiovascular illness.
Thank you for that. My next question is just toggling off the risk management. So you were talking about making sure that you go through some preventive screening services to detect things early. And, there's different ways patients can get screened, obviously the first thing that comes to mind is going to visit their primary care physician and getting screened that way. But can you talk about how local pharmacies kind of play a role in that, and especially community pharmacies? Do they provide preventive screening services? And then a follow-up question to that, you mentioned making sure that you're coordinating all information with your care team. So if they do get screening services at the pharmacy, is that information then shared back to their primary care physician?
Yeah, we always say information is able to be shared for the benefit of a patient back and forth between healthcare providers, and your pharmacist can be one of your healthcare providers. So if
Mhm.
your pharmacy does offer screening, it's usually through centers that have something associated with them, like a little clinic or another little clinic service that's nearby where they can draw blood. Cholesterol and is the one thing that we would have to draw blood. There are finger stick mechanisms to do that, so some will do that. Part of your overall total cardiovascular risk profile also involves checking your blood sugar, especially in patients who are not known to be diabetics. So if we can get cholesterol, blood sugar, and understanding of your blood pressure, your age and your weight and other things play a role, then a total screening can be provided to assess your baseline risk or your risk of having an event within the next 10 years, which is where we want to be really aggressive. So that screening can be done by your local pharmacy. All of those measurements can also be done by your primary care provider. What I say is I always encourage folks to do that for the first time in their early 20s, and so that they know where things are, and then at least every 5 years after that. And then we know when things have escalated. And to try to make all of the healthy cardiovascular life choices regardless of your risk. Primary prevention involves all of us. And so knowing what to eat and how to make healthy heart choices, how to make sure that you get 150 minutes of exercise in a week, no matter what your risk is, and to keep moving are just so important for anybody.
Thank you. There's another question that just came in. It says, how low should my cholesterol be?
So that's a great question. And really, the cut points for how low your cholesterol should be really depend on what part of your cholesterol we're talking about and if you're in that primary or secondary prevention group. So with primary prevention, we like to see that that bad cholesterol or your LDL cholesterol is at least less than 160. And there are a lot of doctors and cardiologists in particular who believe that even lower is probably appropriate even for primary prevention. So we're really trying to identify patients who have primary hypercholesterolemia or high blood cholesterol of a bad cholesterol greater than 190, or have multiple other risk factors and their cholesterol is above 160. And that's the LDL cholesterol again. But one important component is also if your HDL is low, which can be preventative. So we try to get for primary prevention those numbers to be significantly less than 100. And for secondary prevention, less than 70 is ideal and probably
Mhm.
even lower in some patients.
Okay. So actually, this dovetails really nicely into my next question. So patients who just experienced a cardiovascular event. So at this point, we're at the secondary prevention stage. Can you talk more about, what they should be doing, especially if they just had a procedure done, like a bypass or a stent placement, what have you? Obviously they should be taking their medications as prescribed, but what else should they be doing after their procedure?
Now, Jasmine, this is my passion area. So I'm glad you asked me that. For the last 5 years at UK, every patient who has had a heart attack has a follow up appointment with me in clinic. And that's because there are just so many questions and so much to talk about at that time. And a lot
Mhm.
of the things are you've had a heart attack. For almost every patient, it's a surprise, no matter what the risk factors were. It's, I never thought this could happen to me. And they just went through a hospital stay that generally lasts less than 2 days with a ton of information thrown at them. And the information is change everything about your lifestyle and take all of these new medicines, which you talked at the beginning about patients experiencing what we call polypharmacy or taking more than 5 medicines. And the regimen prescribed to a patient who has had a heart attack is already 5 or more medications. So they come out with patients who have polypharmacy. So we sit down in clinic and we talk about and make sure they understand the why about every single one of their medications, why they're important, what the data shows. Let them ask their questions about side effects and what to expect. And then we spend a ton of time on lifestyle. because there are all sorts of questions about what I can and cannot eat, what I can and cannot do, if I should do cardiac rehabilitation or not, and what this really means for their future moving forward. And all of those things are very important, but it's a whole lot of information in a very short period of time. So it's nice to be able to comprehend it, digest it, and make sure that you have someone, if it's someone like me or your other person on your healthcare team, to talk through it all with.
So just a follow-up question, you talked about, changing your diet. There's so many different diets out there that people can follow. And so what is your recommended diet for somebody who has heart disease or is trying to prevent heart disease?
Yeah, there are a ton of different kinds of information out there. The only diets that have really shown to have cardiovascular benefit are Mediterranean pattern diets. So those are diets rich in fish, low in things like red meat, high in fruits and vegetables, whole grains, and even supplemental olive oil. Those diets have shown to be really beneficial. I find that our patients always do a lot better when we talk about what they can eat instead of what they can't. But it is also important to realize that those diets are relatively limited in any kind of saturated fats and in sugary or sweet foods, as well as sugary beverages. I really try to encourage so many calories and sugar come from the things people drink. I really try to encourage a lot of water and water only if possible. And so I think it's really important to look through the diets. If there's a diet that particularly interests you, like vegan or Ornish, or some people are very interested in anti-inflammatory or ketogenic diets, then it's important to talk through what parts of those diets apply to you now that you have a cardiovascular illness or not. And some of that depends on where your cholesterol is and where your individual risks and diets were before. But try to make small changes. And in general, if you're going to pick someone's philosophy to follow, it's probably Michael Pollan, which is eat food, real food, and not too much.
That's great. Thank you so much. So you also talked about cardiac rehab, and it's something that I think people don't appreciate enough, and its level of importance, especially after you have a cardiovascular event. And actually, our speaker later, Chad, he's going to talk about his experience with cardiac rehab. But from a clinical perspective, why is it so important, and what exactly happens during cardiac rehab that just strengthens your heart?
So our cardiac rehab here at UK would say I'm their biggest referrer. So I am definitely a fan of cardiac rehabilitation. And it actually sort of pains me a little bit as a pharmacist to say it's more important than the meds. Now, the meds are very important. And so don't get me wrong, those are part of the puzzle. But participation in cardiac rehab also has been shown to reduce your risk of dying after having had a heart event. And so the reason that is because most of us don't move enough. We need to get moving again. And let me tell you, it can be very nerve-wracking for patients to go out and start going on a brisk walk or a jog after they just had a heart attack. But that's exactly what the body and the heart need. And cardiac rehabilitations train people to do that in a safe and monitored environment. So you go and they might do a stress test or a 6-minute walk test at the beginning of those programs to make sure that things are stable. And then you begin working with exercise physiologists and physical therapists to get moving, to increase your heart rate while you're there, while you're being monitored. And these programs can last anywhere from 16 to 32 weeks, depending on the facility. And I think the added benefit on top of all of that is it's basically a support group. Everyone else around you at those facilities has experienced something similar. And so there's a lot of people who you can see are now having success and are keeping with their goals, are experiencing weight loss, have made dietary and lifestyle changes, have also stopped smoking, are on all the same medications. And there is just a lot of benefit to talking to the person next to you on the treadmill about what they've been through.
Great, thank you. So speaking of medications, the insurance company is ultimately the decider of whether or not a prescription is going to be covered. And as a pharmacist, I'm certain you have a lot of experience dealing with insurance companies if a patient's prescribed medication is denied. And, as you know, the clinician and pharmacists are ultimately responsible for submitting what are called prior authorization documents to the insurance company to make a case for why a specific medication is important. But I think, we should talk about the role that the patient themselves can play in this management part of things. So if they are having issues getting their insurance company to pay for their medications, what exactly can the patient be doing? I mean, should they be seeking out assistance programs? Should they be kind of making sure that they have a long record of their medication journey, or should they just consult with a physician who specializes in navigating insurance denials altogether? So, how would you help somebody, or if you were talking to a patient, how would you tell them to basically play a role in this system as well?
Yeah, Jasmine, I think you're hinting at a very important point, which is that patients have to be their own advocates,
Yeah.
and they have to sort of be part of that puzzle of seeing these things through. So your physician largely doesn't know if they've prescribed a drug and you go to the pharmacy and it's $500. And so what
Mhm.
we really need patients to do is make sure that they don't walk away from the pharmacy without the medication, that they call us, that they inform us, and that they are part of that solution moving forward. Insurance has changed all the time. So we might have even done the work of establishing a prior authorization with one insurance, and then your benefits manager changed over the course of January 1st, and all of a sudden medications that were covered or not, procedures that were covered or not. And so we really need patients to play a role in understanding if something was prescribed, that it's probably important and that a conversation needs to occur and we need to help see it through. To your point, there are a ton of different ways to go about this. So at major medical centers such as ours, we have various levels of patient assistance programs. The pharmaceutical industry, for patients with certain underinsured or uninsured, there are lots of opportunities to get copay assistance or reduction or even free medications. And so if we hear about it, then we will apply all of that knowledge for all the different programs that exist to try to help you. But there always is a role that the patient has to play too. Sometimes it's completing paperwork and faxing it in if it's medication assistance or foundation support that is needed. And so, really, if there's confusion on that, or we have patients who have trouble reading. If you have trouble completing the paperwork, there is no shame in asking us for further assistance, for asking for help, but we just have to get it done so that you get what you need.
Thank you. So we have another question that came in. My insurance company has already denied my PCSK9 inhibitor 3 times. What else can I do? So can you first, for people who don't know what a PCSK9 inhibitor is, can you explain it? And then can you please answer, what else can they do if they've been denied multiple times already?
Yeah, so first of all, a PCSK9 inhibitor is a type of cholesterol medication. The ones available currently in the United States are largely injectable medications and have fairly specific roles in patients in both primary and secondary prevention of cardiovascular disease. In particular, if their cholesterol doesn't get to goals with those statin medications we already talked about, or if they're unable to tolerate statin medications. So the patient who we tried 4 or 5 things and it didn't work. And so these medications are very potent at lowering your bad cholesterol. And so they do play an important role in lowering and achieving the goals for that LDL. So, what insurance companies sometimes require for these medications, because unlike oral medications, and because they are something called a monoclonal antibody, they're very expensive to do the research and development, and therefore the cost of them is very high compared to a lot of our cardiovascular drugs, sometimes on the order of $600-800 a year. So your insurance company wants to make sure that they're using them in the patients who are most likely to benefit. And in our opinion, there's sometimes a little bit of a pull and a tug on that, on whether or not the insurance company is seeing the same risk factors in patient that we are. And so there are appeals processes, as your question is asked. It sounds like your physician and you have engaged several times in the appeal process. Hopefully you have personally called your insurance company and expressed it, and sometimes even spoken to your employer and the benefits office within your employee office, who can sometimes get a special override as well. Those channels, if they're not available to you, then you can sometimes seek outside of that through the drug companies or through foundation support. If you and your doctor agree that this is still a really important drug for you to be on, but usually when we've justified them adequately by having the right cholesterol numbers, showing a history of intolerance to other therapies or inability to reach LDL goals with other therapies, then the insurance companies usually can be persuaded. You've got to get the right people on the phone and make it happen.
Thank you for that. So I thought this question is interesting that just came in. What is your opinion on natural supplements to treat cholesterol? And the term for them are nutraceuticals, but I'd love to hear your thoughts on that.
Yeah, for Jasmine and the other group here, we were talking a little bit beforehand about the role of nutraceuticals and food in prevention of disease. As a pharmacist, we're really geeky, and most of our drugs come from a natural origin. So I understand the importance of natural remedies. And a good example for you is aspirin, that we're all very familiar with its role in cardiovascular prevention and in secondary prevention in particular, comes from white willow bark. And so natural substances have an important role in cardiovascular disease already. But what tends to happen in our current world is that when something has shown significant benefit for lowering either primary or secondary risk of cardiovascular disease, a very smart pharmaceutical company has turned around and really studied the safety and efficacy of that drug, and it has become something that is a legend drug, meaning a prescription drug. And therefore, currently, over-the-counter herbal supplements that we hear about a lot in cardiovascular disease have either not demonstrated efficacy, or they're something that may even have potential safety concerns. So for example, sometimes people talk a lot about fish oil. Well, over-the-counter fish oil products have a lot of potential for impurity. You have to take a ton of them to have the actual type of fish oil or omega-3s that we're looking for, and generally have not been shown to be effective in clinical trials. However, there are some prescription fish oil products that have been shown to be beneficial. And we have to go through usually those prior authorization hoops to make sure that patients can get those. Other things we talk about a lot in cardiovascular disease are things like garlic, B vitamins, vitamin D, and many of these things have been tried in clinical trials and have not been shown to lower your risk of cardiovascular disease, which is why they sort of remain slightly controversial. But on one hand, very few of them hurt either. So I always have an individual conversation about these with patients. If they bring to me something they're interested in taking, we'll look at their entire med list, the cost of that or that over-the-counter product, and really talk about whether or not it has a role in them as an individual. So this is a great opportunity to engage your community pharmacist or anyone in your physician's office.
Thank you for that. That's a great answer. So final question for you. And this is really relevant because we're living in this era right now, COVID-19. So we're at a stage in this pandemic where vaccines are accessible to adults and also becoming accessible to children. So prior to the vaccines, we saw that people living with underlying conditions like diabetes or cardiovascular disease were at much higher risk for mortality. And now that the vaccines are available, can you shed light on any updates or the situation for cardiovascular patients? So how are they doing now that they are vaccinated, and should they be concerned about COVID still?
Yeah, I'm glad you asked this. Cardiovascular patients we have known for a very long time, if they contract a viral illness, it can exacerbate their underlying cardiovascular conditions.
Right.
We have known this from a standpoint of the flu, influenza, and pneumonia for years, which is why cardiovascular patients, it is recommended to get the flu and pneumonia vaccines. Has always been. This has not been controversial. COVID-19, we saw the same thing. And with Delta variants, we see the same thing. Patients with underlying cardiovascular illnesses are far more likely to experience significant complications and death than patients who don't have cardiovascular conditions. We see this astronomically smaller in patients who have been vaccinated. The vast majority of patients who have received both vaccinations, even with cardiovascular conditions, are less likely to have severe outcomes. And so we wholeheartedly recommend that our patients were vaccinated as soon as the vaccination was available. We were extra cautious in moving to telemedicine opportunities for our patients before that time. And we are, actively evaluating the role of boosters in our patients, as well as the role of vaccinating children who live in the home of our cardiovascular patients, as well as children in our community, so that we may both help prevent their risk and the potential for spread to adults. So it is very important. I don't think we can stress that enough. We do feel that they are safe and effective and play an important role in patients with cardiovascular illness.
Thank you so much. Well, that concludes our panel. I wish I could talk to you for more time, but unfortunately we're running out. Thank you so much for all your insights, Dr. Macaulay, really very interesting. And those watching, next time you see your pharmacist, please thank them for all they do for you. Really, they do a lot. My own mother is a pharmacist and she works so hard on behalf of all of her patients. So now I'd like to turn it over to my colleague, Olivia Medina, who will have a conversation with somebody living with heart disease. Olivia, on to you.
Thanks, Jasmine. Hi, everyone. My name is Olivia Medina, and like Jasmine said, I'm with the Partnership to Advance Cardiovascular Health. We call it PATCH for short. We are so excited to be joined by Chad Witheridge. Chad survived a massive heart attack, but today is a dedicated patient advocate. He created myheartmission.com, where he shares his story, writes regular blogs on what it's like living with heart disease, and in his case, specifically familial hypercholesterolemia, a genetic cause of high cholesterol. So Chad, welcome. Thank you so much for joining us. It's so important for folks to hear from people like you about what it's like navigating the heart disease journey. And so Dr. Macaulay just gave us a great overview, but as you know, being a patient advocate, there's so much to learn from the live experience. So your own story and discoveries are really what we're going to get after today. And that's really what's going to be beneficial for the patients here on this webinar. So with that being said, let's get into it. Can you please tell us about you, tell us how old you are, what your family is like, and especially what you do for fun?
I'm 38 years old. I had a heart attack 2.5 years ago. And I have a wife and 3 beautiful children, 17, 12, and 9. And on our free time, we kind of chase them around in sporting events, and we love to fish. We love to spend time outdoors. We enjoy family time as much as we can. Definitely a busy life with 3 daughters. One of them heading off to college next year, and family is number one important for me.
Absolutely. Sounds like you are an active family man, and 3 girls, that's my family too. So it's the best way to be. Definitely complicated and chaotic, I would say, but amazing. So with that being said, you said you've been running around, big family man. So can you just take us back and just explain for the audience and sort of level set what happened the day of your heart attack and how was that impacting you today?
Yeah, so I was running a soccer tournament actually, and I wasn't feeling well. Things were going good, but I started getting kind of dizzy, kind of sweating, nauseous, really agitated, and that's not me. I'm a happy person and love talking to people. And so I started feeling sick, and a friend of mine was actually there. He's a lieutenant firefighter. And we decided to go to the fire station just to see what was going on. And they hooked me up to the 12 lead, the EKG, and we were upgraded pretty quick to ALS, STEMI heart attack, and we're en route to the hospital.
Wow. Okay. Yeah. So it went 0 to 100 pretty quick. You think you're just having a normal family day, family weekend, and all of a sudden sort of disaster kind of hits. So
Absolutely.
When you are taken then to the ER, what was that experience like? Did you receive the diagnosis immediately? How was that all happening?
So the diagnosis did not come immediate. On the way to the hospital, you're looking out of the back of the ambulance thinking, am I ever going to see my family, my children again? And that definitely hits you hard. I'm sure there's many people out there can relate to the same exact experience. I suffer from PTSD a little bit because of that. I live with it every day, and I really enjoy sharing the story about that. But yeah, FH, familial hypercholesterolemia, was not something immediate. It took time. Being in the hospital for 6 days, 2 different procedures. I have 4 stents now.
Wow. Okay. Yeah. I mean, that is just, like I said, 0 to 100. So, can you also then level set what FH is for the audience, how that sort of impacted your cardiac event, and all the details you live with now?
Yeah, sure. So a genetic condition, it's very common. I was tested at a young age. I knew that my family had high cholesterol problems, but at 36 years old, you don't think of something like that happening to yourself. It's just something that I live with now every day, with the medications that I'm on, and yeah, it's very common, and it's very easy to get tested.
Right. So I want to dive a little deeper into that. So we, like you said, we know it's not necessarily a rare condition. So how would, let's say, I know I had FH if someone like you had lived, XYZ many years and they had never known?
Sure. So getting the blood test for your LDL cholesterol and your lipids, asking family members, talking to your elders and siblings if they've gotten tested. It's not something that's talked about at a dinner table or Thanksgiving dinner, unfortunately. And to know your family history and to get tested, to talk to your primary care physician to see if that is something that is possibly something you're living with. It's truly very simple, and communication is the most important.
No, I love that because I think, especially with the work that we do, we hear a lot about awareness and more so lack of awareness. I think people are not aware of all the risk factors that can really lead to these, like you said, traumatizing events for you and your family. So you say communication and, just talking to your family can help. But did you ever then, even with your family history knowledge, did you ever think that this could be a possibility, that this was something to seriously consider in your life?
Not really. Like I said, I did know that there was the family history. But like I said, at 36 years old, you don't really feel that you're going to have an event like I did. And it was truly life changing after that.
No, 100%. So then especially with FH being a genetic condition, have you or your family sort of then adjusted lifestyle changes for not only you, but then for your 3 daughters as well?
Absolutely. So my youngest daughter has now been diagnosed with FH, with cholesterol levels LDL over 200. We are definitely aware of what we eat. I have not had a ribeye steak, which I love so much since my heart attack. We eat as many fruits and vegetables. We shove those things in those girls' lunches, and they love them anyway. They know the experience. They experienced it with me, so they know that they have to do everything they can to help me stay on track, as well as they know that the potential risks for them. Even at my 9-year-old daughter knows that she's living with this disease, and she does as much as she possibly can. She's not on any statins right now. We are talking to her lipid specialist at Children's Hospital about statins, but we're not ready for that yet.
Right. No, I think that's great. I think it's never a bad time to educate people on their own personal heart risk. And I think especially in a case like yours, where awareness was really just what we needed. So yeah, I'm going to pause for a second. We have some questions from the audience. So this one says, I've heard both from the patient and practitioner to get checked in my young or early 20s. Did your insurance cover you getting checked?
Yes, it did when I was younger. Just knowing the family history, and thanks to my mom knowing the history, my grandfather had an aortic valve replaced, triple bypass. So we knew. I was actually there during some of his procedures. was present when he was having his heart attack camping. So I knew it was something that was gonna, be in my future. My insurance did cover it, and it was at a young age I got tested.
Okay. Okay. Well, that's great to know. Yeah, exactly. So I want to go back to the cardiac event itself, and I want to sort of let patients hear your story and see what you've learned from that. So we're back at the ER. You don't really know what's happening. You're scared, alone. It can be overwhelming. So, what did you find to be the most helpful during all that process? What was sort of your North Star of like, this is something that I need to do, and this is like a great resource for me?
So when I went into the cath lab for the first time, even though I was a little bit out of it from the morphine and the back pain I was experiencing, I remember the entire procedure, and it was really crazy to know that there were doctors around coming in, talking to me about the process, and I felt comfortable, even though I knew it was a life or death situation. And for them to come in and assure me that this is, going to be okay, this is what's happening. I felt confident going into that cath lab, and I knew I was going to get the care that was meant for me.
That's great to hear too. I really think, especially with these big life events, having a strong physician patient relationship, it makes all the difference. Like you said, you were able to trust the person, you're on the same team, they're all trying to get you healthy. So that's great to hear. I want to do one more question from the audience. It says, where do you get your source of information from? I get so confused because I read conflicting advice on different sites. So have you found any sort of clarifying resources, or how did you navigate, Google, WebMD, and all the scary statistics that are out there?
So, I mean, that's one of the things that I started doing immediately was doing research on Google. It
Right.
led me to sites like the Familial Hypercholesterolemia Foundation. They're a great resource. Patch reached out to me shortly after that, and we became good partners. I'm really, the knowledge is out there, but trust your cardiologist, trust your primary care physician, and any other specialist that you're dealing with, because it's definitely something that you want to have as a whole in a group to help you with this process.
No, I mean, like I said, 100%. That makes so much sense. And I want to touch base on sort of now you got all this information, you're in the recovery process, you're sort of, I mean, not back to regular day life, because I feel like that's sort of impossible to return to after you've had a crazy cardiac event like this. But what Dr. Macaulay kind of mentioned, the cardiac rehab and how beneficial that is for patients. And I feel like everyone knows about physical therapy and how you get physical therapy after a major surgery and you're sort of rebuilding that muscle. And I don't think people know about cardiac rehab, and that's for your body's most important muscle. So I just wanted to hear your experience with cardiac rehab and really how that benefited you and made you stronger.
Yeah, so I didn't start cardiac rehab immediately, as there's a wait list in a rural area where I live. But when I got into the program, I felt like I excelled in the program, and being younger, that I had maybe more energy. And typically, the cardiac rehab, I believe, was about 30 weeks, and I finished it in about 20. They were confident that I was, doing well and making strides moving forward, and continuing to get stronger and stay healthy. That I didn't have to complete the entire rehab program, which I did complete it, but just in a quicker pace than a possible patient.
Right. No, that's great. Like I said, having the live patient in front of me telling me how great it is and the practitioner, I just can't imagine that more people don't know about this benefit to recovery. So I also want to sort of add to that. So you did the cardiac rehab. Let's say you're back at home now. How are you managing cholesterol levels now? What is your day-to-day like? What is diet and exercise like? How are you doing now managing all of it?
I am exercising. We have a bike at home that I ride on a regular basis. I could always do better. We can always do better.
Yes.
I do, my diet and exercise plan isn't solid. It can always be better, but it's just something on a day-to-day, a busy life schedule. You have to make time for it, and that's the most important part. With my medications, at 38 years old, I'm on way too many medications for a young adult. But it's also necessary to keep me going, and I won't be on these medications for the rest of my life. Some of them I will, but as soon as I'm able to get off these medications, with contacting, my primary care provider and my cardiologist and my lipid specialist, we have a plan, and I'm definitely sticking to that plan.
No, that's great to hear, especially with the communication between the specialists and providers. I think that's so important that everyone's on the same page, yourself included. But I wanted to dive a little bit deeper into that. So you said the medications can just be overwhelming. I think you're sort of, Dr. Macaulay hinted that you're sort of given, a plethora of medications, a huge packet of information that might not all be that digestible. So how have you found ways to stay adherent to that and to sort of not just give up and just be like, okay, I'm not going to take this anymore? And so do you have any tips for patients on that?
Well, I have not missed any medications for 2.5 years. I have one of those pill things Monday, through Sunday of the pills. There are some times that I forget to take them at the exact time that I want to. Every single morning, my phone beeps at me at 10 o'clock saying pills. And it's just something that helps me remember. In the evening, I take my statin, and it's just a thing just before I go to bed. And it's just something that to me is now part of my everyday life. But honestly, with my 3 daughters, that I know that I need to take this medication. I need to stay healthy because I want to love them for as long as I can.
Absolutely. I love that too. And someone in the audience does too. They just said, I love my pill pack. So you are not alone with waking up every morning and doing that. I think that's unfortunate. And not unfortunately, I think that's just the way it is. And I love that you're able to continue to do that. So I want to stick with some audience questions because we have a few. So this one says, I've also had a heart episode and have experienced anxiety afterwards. How do you cope? It's something I've always struggled with.
Anxiety is definitely real. I did not suffer any anxiety before my heart attack. Like I say, I live with PTSD from that day. There's times where you're in an environment where maybe you're more uncomfortable. When I travel now, when I'm with my family, I always want to make sure where the nearest cath lab is. I want to know not the exact route to the hospital, but I plan for that moving forward, to know that if something were to happen, I have the plan, and this is kind of how it could possibly unfold. That adds sometimes to the anxiety. I relive it all the time. myheartmission.com. I share my story, and I talk with patients and people that may haven't experienced a heart attack, but may experience a heart attack, and not knowing that they're going to experience a heart attack with high cholesterol levels. And I love talking with people about it. So I live with the anxiety, but I also try to accept it. And instead of push it away, I embrace that anxiety. And with other people experiencing that same type of anxieties I do, communication, like I've talked about before, is so important. You can't hide it.
No, I agree. I mean, that itself is just communication, I think, between patients and, like you said, your family members. You are now looking up the nearest places. Like that's something you probably never considered to do beforehand. So it really does change the way you think about things in your health for indefinitely, I would say. So I'm going to stick with the questions again. We have a couple more. So let's see. How important do you think the communication is between providers and specialists during the recovery process?
I believe it's 100%. It's very important. With my primary care provider, as well as my lipid specialist and cardiologist, they're not talking consistently, but with the way we're talking together, and passing information back and forth is really where it's so important. And it really starts with the patient. Because you are the one who has experienced it the most personal, giving that information to the doctors that are taking care of you, and you have to listen to your own body, and that to communicate with each one of them, and they can pass the information along to other doctors, and that's it. Yeah, it's all about communication.
Agree. And I love what you said about listening to your body too. I think that's so important. Like you listened to your body that day and thankfully were able to get help before something worse happened. So I think that's just such a good intuitive part as well. So we also have a few more. After having your heart attack, is there anything you can't do physically?
No.
Okay. So you remained active, you remained doing all of that, still the same go happy, go lucky guy.
Yes.
Love that. Okay. I think the patients need to hear that too, because I think also when you hear about heart attacks, you kind of just assume that person is either one, old, or two, has some other underlying health condition and is just sort of debilitated. So I think you being like, no, actually, I can live my life normally is great advice for people.
Yeah, I
So we
mean,
have
the
time for
anxiety is definitely there, but you can't live your life in fear.
100%. So we have time for probably one more question. So let's do this one. So we've talked a lot about just your own experience and prevention obviously being a huge part of it, but that's not always possible if people aren't aware of the risk factors. And in your case, you weren't. So, what would you say the biggest piece of advice or the biggest thing that you learned in your experience being unaware of all those risk factors? What would someone in your same boat need to be doing to sort of prevent that from happening?
Definitely early detection. Test your cholesterol. It's a very simple. Talk to your primary care provider. If you have to get on a statin, eh, it's something. It's easy to do. And I was on statins when I was younger, and off statins and changed. And the reason I had my event, I believe, is I was off statins for uh, 10 years, and you think you're young and there's not going to be any problems. Insurance has changed, and with the help of Patch, I really feel that they're helping patients become more aware of your options and working with insurance companies, and the education is out there a lot more than even 10 years ago.
100%. So have you found good patient resources? I know you started your own website full of resources, but have you found benefits to other patient advocacy groups or just speaking to people, who have similar stories to yours?
Yeah, so I mean, even when we're on a vacation and we're sitting by the pool, it typically comes up that I had a heart attack, and talking with people. Oh yeah, well my grandfather had a heart attack and my father had a heart attack, but I've never been tested. And I look at them and with pretty serious conviction saying, get tested now because it could save your life. And then that's usually when I go into my story about I experienced the same things, and my family had the same history. And that's talking with potential people that don't even know that they're going to have a problem is so important. Like I said, Patch has been a great website, and they're great people. Also, the FH Foundation with the disease that I have is great information out there. And once again, talking with the physicians, sharing your personal experiences, they're out there to help.
Right. No, I love that. I agree. So I'll do one last question from the audience before we have to go. But they asked, are any of your children on medication? Because you talked a lot about, we think we're young, we think we're invincible, we think nothing bad's going to happen, but maybe we do need medication. So have you found any of that to be helpful yet for your kids?
So my youngest daughter, she's 9. Her cholesterol's over 200. We have not started a plan yet with her on statins, but it will be something in a discussion. She knows that she has high cholesterol, and she doesn't want to be on medication. She doesn't like taking pills, which nobody
Mhm.
does.
Right.
But in her life, she will more than likely have to be on some type of therapy to help with this disease.
Okay. Well, that's good to know, Chad. And I just want to say thank you again for joining us. We are unfortunately out of time, but you helped me learn a lot. I know you helped our audience learn a lot. And I just want to say thank you again. And we look forward to talking to you soon.
Thank you very much.
Well, with that, I just wanted to say thank you again to my colleague Jasmine and to our two speakers, Dr. Macaulay and Chad. If you guys want to learn more about our speakers, Dr. Macaulay can be found on Twitter and also through our Patch Twitter. And then, like I said, Chad's website and blogs can all be found on myheartmission.org. If you're interested in learning more about Patch, we are a patient advocacy organization focused on health policy. So if you are ever interested in joining, membership is free. Below are all the ways that you can connect with us. And again, I just want to say thank you everyone for joining, and we look forward to seeing you all soon.